Hello and welcome to Aging Insights. I'm Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well. And today we're going to talk about integrated care, a comprehensive approach to senior health. We have two special guests with us today. We have Lynda Hollander, a psychotherapist at the Mental Health Association who works with older adults with chronic mental health issues, and Rachel Hayley, a licensed professional counselor who runs the Senior in Home Therapy program at Mental Health Association. So Rachel and Lynda, thank you very much for joining us today. And why don't we start a little bit about telling us about yourselves and your work and your experience with older adults?
I am, like you said, the director of the Senior in-Home Therapy program where we offer in-home therapy for mental health to seniors all over Morris County, New Jersey. And I worked in the program since 2019, and then I became the director in 2022.
Mm-hmm.
And the work that we do is really addressing the mental health needs, removing barriers of mobility, of being able to go to a place to get therapy. We go to the person to address the needs and integrate them and work on integration, their mental health needs, depression, trauma, community needs, all the above as part of the treatment. And I love doing this work. And we are funded by the Morris County Commissioner's Office.
Mm-hmm.
So we get to do this work and serve the community, and I really love doing it.
So I work at the Mental Health Association at the Montclair office. I'm a psychotherapist and I specialize in older adults with chronic mental illness. Before I did that, I have experience working with older adults in an institutional setting, having been a nursing home administrator for 20 plus years.
Oh, wow.
So currently I am the psychotherapist and I do work in the community as president of Aging in Montclair. So I work both in the community and in institutional setting.
So I guess I wanted to start by asking you, how are the mental health needs of older adults the same or different from people at other ages and stages of life?
Yeah, I can talk about this one, and then if Linda wants to add anything. So I think that there's base kind of like mental health needs that I think everybody deals with, like depression, anxiety, life changes,
Mhm.
grief, complicated grief, trauma. So I think all those are common throughout the lifespan. But I think specifically with older adults, they're due to aging and added maybe like lack of support as you age, or maybe change in finances, right? As you age, you're on a more of a fixed income, so your access to mental health support might be a little bit less. Another one could be like mobility issues, not being able to get to the places that you used to get to. You might not be able to drive. You might not have you might be socially isolated in a very particular way that other age groups don't experience in that same way. So I think there's the base things that are very much the same that we can all connect through. I mean, also like cognitive decline, remembering things, I think could be differences as well. So, and it might be like things that are like, subtle differences. It's not necessarily like dementia, but it might be like taking a little bit longer to remember everything you need to do in a day, having to find different ways to keep your routine, things like that. Linda, do you want to add anything to that?
One of the things that I think is different from what I see doing the work of MHA is the stigma. I think that
Mm-hmm.
older
Oh,
adults
yes.
have more of a stigma associated with getting help for mental health issues than maybe younger people. I think that might be a generational kind of a thing.
Yeah.
For
Let,
sure.
let's let's talk about the stigma and about ageism too. So, do you think there's a stigma among people of certain ages that makes therapy or mental health either, a treatment option or a taboo? For example, I think that younger generations, like college students and in their 20s, are very open to talking about mental health or seeking treatment. But the we call them the greatest generation. They had amazing lives after the trauma of World War II, but they didn't talk about it. So what
Right.
is the stigma? Why is it there?
Mm. I think the stigma is so I think it's two ways, right? I think it's like within the generation and outside the generation, if that makes sense.
Hmm.
Like, so within it is kind of what you're talking about, like, within like it's, not talking about things, just that's not the way things are done, right? Like,
Right.
there's no need to talk about it, no need to bring it back up. Cool. I've heard this before, like, I don't need to see a shrink, right?
Hmm.
Using that kind of language, I'm fine. Like, this is like, we don't talk about these things, those kind of things. So within that, or like, I don't want to be a burden, right? Like, I
Oh,
don't want to, put this on you, that kind of thing. Like, so it's, the stigma I think comes like within where like people might have different feelings about what going to a therapist actually means from what they know that it means. So they, I think we've tried to do a lot of things, especially at Mental Health Association, to help break that stigma. But I think it's, it lingers for sure. But I think things are getting better. I think like using language that our older adults can connect with, that makes sense. And I think the stigma also is like outside of this population where we think of older adults in a particular way. Like, we think like, when you get older sometimes, and this is like a stereotype, right? So like that you're not useful, you end up not
mm,
being integrated into society because it's almost like you're out to pasture at a certain
right.
age. And that sometimes is in the way like society is structured, specifically American society. So I think that like community integration and using an integrated approach is bringing like our older adults back into like every part of life rather than just being separate, because I think that's part of like the stigma. Does that make sense?
Mhm. That makes a lot of sense. And I think also, I guess on the flip side of that, there's ageism where providers or other people, like family members, might think, oh, well, this is, of course, people get depressed as they get older. They think it's a part of aging. So not a mental health issue, just like this comes with your age. Um, so do you think there's ageism there where on the families or healthcare providers are just kind of dismissing it as normal aging?
I think that people don't have the education if they're not clinically trained. And to Rachel's point, it becomes this thing. Yeah, you're old. You're supposed to be depressed. You're not supposed to be able to do certain things anymore. And another point you made is culture. I think there's
Mm.
a lot of cultures that don't accept mental health conditions, that they don't feel they have priority or even exist in some cases, that you're older, you're supposed to just kind of suck it up and just move on with your life. So I think the Mental Health Association in particular um, provides education for the community to ensure that people understand that mental health conditions are not necessarily a part of
Mhm.
aging.
So, what are the most common mental health conditions you see among older adults?
So I think in our program in particular, so where we're seeing anyone over the age of 60 who lives in Morris County, I think particularly in that program, a lot of the issues stems from social isolation and like loneliness, and also the trauma that's connected to life transitions. So, what I mean by that is, like, for example, someone could have been living most of their lives, maybe married in a home. Their kids grew up, they have grandkids, maybe and then they come to a point where maybe their husband passes away and they're a widow now. And and they're faced with the fact that they have to live on their own. But as they age, maybe like their grandchildren don't come around as much, their adult children don't come around as much, and they have to rework their social group, have to rework everything that they've come to know because maybe people have moved away, maybe they've lost friends, and they have to like make new friends at this point in their life, and kind of like that, those kind of similar feelings, in almost like adolescence, of like that insecurity of like meeting someone new and making new friends and things like that, and then added with like maybe there's possible mobility issues, getting connected to resources, getting transportation. So I think with our program in particular, that loneliness, what sometimes ends up happening is that, they end up staying home
Mm-hmm.
so that they don't have to deal with all those like barriers. And then after a while, that loneliness, that social isolation takes a toll and impact on their entire mental health. And I think what we do is we help create a plan so that not only with the counseling, but also like integrating in a plan of how to get them connected again, like what's available in their area, and also like practicing kind of like engaging with with new people, building
Yeah.
those
Yeah.
relationships again. So I think that's a big part of the work we do, while integrating like maybe the medical issues that may come to play, or anything else that's keeping them from being able to like leave their homes. Lynda, do you want to add anything to that question?
All right, so compared to Rachel, I do not in home. My clients come into the office, and a lot of them have anxiety stemming from a lot of the issues that Rachel's saying. There's a lot
Mm.
of what if, what can I do? This has changed. I don't have friends. My partner's passed. My kids moved away. So that definitely creates a lot of anxiety and depression, and that's what I mostly see working with my clients in the community.
Wow. You mentioned social isolation, and that's something we talk a lot about. I think if we started talking about it under COVID, but it was there before COVID, we just didn't get the
Right.
attention. And it does
Right.
have an impact not just on your mental health, but on your physical health as well. Like I think the former Surgeon General said that um, social isolation can be as dangerous as smoking a pack of cigarettes a day to your health.
Yes.
And something that's I've noticed is social isolation. It's like a path you go down together. It's not just one thing that happens. So it's not just one way to get out of it. It's not just, oh, here's the right program for you, the right friend, the right activity at the senior center. It's a
Right.
process to reintegrate and to end social isolation. Can you talk about that a little bit more?
Sure. So I think that like with social isolation, exactly what you said, like it is a process and it's by the individual. So I think a lot of times we start with like, because I think when you get to like, when you're getting older, you get to a point where a lot of people are making decisions for you rather than people asking you what you want. What do you want your life to look like? What do you think will be good for you? Like, you were an expert on your own life. You've been living your life for 60 plus years. And then all of a sudden, people start saying what's good for you, right?
I
So
like
I think,
that. You're an
yeah,
expert on your own life. I like that.
yeah, so I think that like as the professionals, we kind of bring our expertise to their expertise, and we make a plan as to like what exactly they would like to work on. So if they want to address the loneliness, okay, like what are the communities of people around you? What are the relationships that you have already built on? How can we increase that? What are the available resources around you? What are some things that are realistic that are maybe some goals you can do? Like, for example, maybe the goal is to go to the weekly group that you've been wanting to go to, but you've been maybe anxious about meeting new people there. So we would talk about, okay, how are you getting there? Is there anyone you can go with? Even to the point where we might even like we do some in vivo stuff where we might go there with them. Like, so I think it's whatever is most appropriate for what they're dealing with, we try to address, like, or like, for example, another person I can think of where they were really connected to their religious community, but they aren't able to drive anymore. Okay, how
Mhm.
can we stay connected? How can we use technology to stay connected?
Mm.
And walking them through how to, we're on Zoom now, right? So how do we use Zoom? Like how to use your phone, how to use YouTube. Like I think all those things help people stay connected, how to use FaceTime. And so those things are maybe a little bit more like unconventional that we won't traditionally think that's part of therapy. But I think like those are the needs, right? So if someone needs
Mhm.
someone to sit with them and teach them how to use a technology, whereas maybe they have a grandson or granddaughter who doesn't have the patience, like we're there to help them walk them through it and practice with us. So that's just a few examples of like where we can work on individualized plans for the clients that we serve. Lynda, is there anything that you can think of that you do in particular with your program?
So one of the things that comes to mind is usually the children feel their parents are more socially isolated sometimes than the client actually feels. The
Okay.
the children will
Mhm.
say, "Oh, my parent doesn't go out." So what we kind of do is do an inventory with them. What did they do? Some people never went out, but now social isolation has become such a buzzword that that's what is thought of them, but they never went to bingo. They never were active in their
Mhm.
community, and really it's okay. So sometimes it's the outside forces that feel that they are socially isolated and they get pressure, and then they believe that they're socially isolated. So
Mhm.
I think there's both sides of the coin. So people do need to be pushed, but then some people do and are satisfied staying at home.
Well, that's important. That's really important to distinguish so that people aren't projecting onto their parents what or other loved ones what they are concerned about. I remember back when you spoke at our conference, one of the things you talked about was grief. And I guess there's different types of grief, which I hadn't been aware of before. And grief is something that, in many ways we expect older people to have experienced at some point in our life. We're all going to experience it, but just from your culmination of years and experience, they may encounter more. So can you talk about the different types of grief and I don't know, I guess what is within the normal bounds and when it's a flag for concern?
There's a lot of what I call ambiguous grief or ambiguous loss. Those are for people who have loved ones who have cognitive issues or a Parkinson's type disease that they're dealing with, and the person is still alive and with them, but they're not the person that they were before. So that's really a lot of what I deal with out in the
Okay.
community.
So just to add to that, I think like there's all different levels of grief, and I think sometimes it can become complicated, meaning
Hmm.
like there's layers. So it could be like multiple losses, similar to what Linda's talking about, but added with maybe death losses, non-death losses, and it ends up kind of like complicating the grief because it could all happen within a span of a few years. And I think what like a telltale sign to me is kind of like you say it's been maybe 5 years and from day one to day five you feel the same.
Okay.
So the complicated grief I think is often like not addressed because maybe like the health issues are coming first, and that's what maybe like your support around you is focusing on, but no one has really asked you if you're okay.
Mm.
So like I could give you an example. One of our clients, um she lost her daughter from cancer But however, prior to that, she also lost her mom and her sisters. And then she was on a fixed income because she had her own business. And then she ended up moving to an assisted living facility that was a little bit farther away from people. So I think like it just sometimes it builds. It
Mm-hmm.
builds and builds and builds. And until like someone asks you like the direct question, like, how are you doing? Like, what's on your mind? Those kind of questions where they're checking in with the person, I think it's hard to see the grief. Like there isn't a like particular like look, but I think like, staying in bed, and if that's not like a normal kind of behavior, right? So like staying in bed, not wanting to do the normal things you typically do. I think also like not having a place to reminisce, right? Like not
Mm.
wanting to reminisce. Reminiscing could be very healing for some people, and sometimes that could be very painful as well. So I think grief can come up in different kind of ways, and different levels of grief can be all active at the same time. So, like that, the stages of grief, I think, don't really kind of, not that they don't apply, but they don't happen consecutively. They could all be happening at the same time with
Okay.
different levels to each kind of grief. And that's what kind of like makes it complicated. But not everyone experiences complicated grief. That's just one kind that I'm thinking of that I've
Mm-hmm.
noticed with some of the clients that we serve. And then also grieving yourself, right? Grieving the fact that maybe you don't see as well as you used to. Grieving the fact that, you know, the some of the things that you used to love to do, you're not able to do it either at all or in the same way, depending on what
Mm-hmm.
it is. Having to, depend on other people for certain things. So maybe like some of our clients get meals sent to their homes, where they have to eat different kinds of foods that maybe they weren't eating before because of, some issues. I could think of a particular client who had like tongue cancer repeatedly, and she would get so sad that she couldn't eat the Italian food that she loved. So she was a big cook in her life, and she always had beautiful Italian meals, and then now she couldn't eat the food she wanted to eat. And that was really like painful for her. So I think
Oh,
there's
wow.
grief in different ways that we don't think about when it comes to like what happens to our bodies like when we age. That makes sense.
And I think another point is everybody grieves differently, as Rachel
Mm-hmm.
was saying. And people say, well, how long should I be grieving? I don't think there really is a timetable for that as well. So that's another thing that, I try to point out to the clients that we see.
So there's not a right or wrong way to do it.
Correct.
So is there any kind of predictor for your mental health in later life? Like if you've never had a problem, if you've never struggled with depression or anxiety or had problems in your youth, does that make you immune from mental health struggles when you're older? Any prediction there? You're both
No.
shaking your head.
No. I would argue and challenge even the question because I
Okay.
think like I forget what the statistic is, but most people experience depression throughout their life. So I think what happens is it turns into like maybe a significant mental health issue, maybe if it's lasting more than like 2 weeks, something like that.
Okay.
So I think that like having never had any kind of anxiety, depression, worrying about things, trauma, like not one, you know what I mean? I think that would be, hard. However, I think if it hasn't been an issue, like you haven't gone to therapy or you haven't been on medication is probably like more common. Like we
Okay.
find different ways to cope, right? Like we have our friend groups, we have our church communities, we have different activities we do. So we find different ways to cope without going to therapy necessarily, you
Mhm.
know. So I don't think therapy is always the answer for every mental health issue every single time. I think it's an integration, right? So but I do think that like not that they're a predictor, but there are warning signs, right? So like some of the warning signs is I think is just kind of like noticing like not doing the same things you used to do. So like say you used to love to sit on your porch every day and people watch, and then all of a sudden you stop doing that. You know, say that you would call up your sister at the same time every day and you stop doing that. You know, just like some warning signs that are there that let you know maybe something, maybe to ask more questions. I do want to like plug, like it just made me think of it like mental health first aid. Like I don't know if you've heard of mental health first aid, but
I've heard
it's
of it, but I
a
don't know much about it.
Y- Yeah, so I can tell you a little bit about it real quick. So it's pretty much like a training that is for lay people. It's not just for mental health professionals about like basics of mental health, like what to look for, what are the warning signs, you know, how to help someone if they're having like suicidal ideations, you know, things like that. So substance abuse. So just for the lay person. And I think something like that is good for the communities, is good. They have a older adult specific one. And I actually am an instructor for that training as well. And I think that like just having like the people like the our community as well, like our community as lay people, and then people and older adults themselves, just having basic understanding of what could possibly be a mental health issue, doesn't have to, but just asking questions and inquiring and being there for someone genuinely, you can start seeing some warning signs. And I think the telltale signs is just like significant change in routine,
Mhm.
is a big one. Do you have any of them that you can think of, Lynda?
Thing that comes to mind is loss of appetite could be one. Not showering is
Mhm.
also a really big one. Um, so for me, anxiety and depression, like Rachel alluded to, can be at any time in your life. Some of the more chronic conditions, which don't appear as you're older, but actually appear as you're younger, but stay with you, are like schizophrenia or bipolar disorder. And this is something that gets diagnosed usually in your 20s, but it remains with you throughout the rest of your life. So you can have those chronic diagnoses and depression and anxiety and obsessive compulsive disorder. So then it gets kind of compounded depending on what your life circumstances are.
So after hearing all of this and learning more, what is a call to action for people who want to help their loved ones, their friends, the older adults in their life? What can and should they do?
I think that the first thing is like really checking in with the older adults in your life and really being concerned about like what's happening with them internally, not just the things that are happening externally, but internally, right? Also, taking some thought into how health issues change, life changes, and you know everything that happens like with the aging process is integrated as part of be impacting the mental health. Now also what's in your community. Every community has different things that they can offer older adults,
Hmm.
whether it's transportation services, whether I think there's like different aging well grants that have gone throughout the state.
Hmm.
um our program gets funded by through the Older Adults Act. So for example, the Division of Aging in Morris County, they divvy out all the grants for all different kind of things. So we have telephone reassurance, we have home health aid grants, different things that are different pieces of the puzzle that come together, um, for community integration. So I think a call to action is educate yourself on what's in your community so you are equipped. And that's for lay people and that's for mental health providers, especially if you're seeing older adults. Like, just know what resources are around you. And then I encourage, and then also at maybe like a higher level than that is just like advocate. Advocate, if you are someone who's in a place to be an advocate, like I think it's one thing just being a voice for someone who maybe doesn't have the same access as you and
Mhm.
advocate for those fundings, advocate for programs, advocate even starting your own group if that's something, like a peer group or something like that, if that's something you're interested in, creating an environment for older adults to just be part of community and not separate. I think the call to action is to make this important to you. What about you, Lynda?
I agree with everything you said. One thing that comes to my mind is also getting your primary care physician involved. So if family members see a change and lack of eating, hygiene issues, maybe to have that conversation with your primary care physician as a start to the medical piece, which Rachel alluded to. Health issues also involve polypharmacy, as I call it. A lot of senior adults take a lot of different meds prescribed by a lot of different providers, and there's
Yes.
really no gatekeeper to that. So sometimes looking at that with the primary care physician can help mental health issues, believe it or not.
Mm.
And I think the other distinction, we talk about seniors being 60 and older, but seniors are living older and older. So for example, in Aging in Montclair, we range from 60 to, I would say, 98. So yes, we're all aging, but the 60 and 70-year-olds are aging in a different space than the 80 and 90-year-olds. So
That's
mental
true.
health is different for those aging because the age group has really expanded.
I'm glad you pointed that out because one of our constant fights against ageism is lumping everybody in together. And we don't do that at any other point of life. We don't say that all students, kindergarten through senior in high school, have the same exact need. And we don't say that all
Right.
working people, whether it's your first job at minimum wage we don't lump them together, but then we think, oh, you turned 60 and everything's the same. It's not. So thank you for recognizing those differences. And yeah, people have different experiences um, as we age. Now it's a 40-year span we're looking at, which is a wonderful thing and wonderful accomplishment. And we need to be prepared for helping people live those next 40 years and living them well. So thank you for
Absolutely.
everything, not just for the work you do, but for sharing this with us and explaining this. I think that what was really interesting to me is some of the things that you described as signs are also signs, could be interpreted as signs of dementia or a medical problem. And we have to look at them that maybe it's not medical. Maybe there's not a pill for it. Maybe it's like the result of pills or medication. Maybe it's the result of something else. So to really look at not just like something as a normal sign of aging or that if they have this issue, it has to be dementia, but really being open to exploring the mental health. And I think that we can all learn a lot from this. So thank you for joining us. And as we close out, we're going to put on the screen here a list of resources where people can go. Every county does have in its county office on aging, they have mental health services. And you can also check our website, njaaw.org, for a list of resources available to older adults in New Jersey.